first of all, getting into early growth faltering, we'll first understand what is growth faltering itself. What do we understand? हम क्या समझते हैं growth faltering से? And it is very critical that there is a growth standard that defines how do children grow or how should children grow. बच्चों ने कैसे ग्रो करना चाहिए, इसके लिए कुछ स्टैंडर्ड्स दिए गए हैं, जिसे WHO ग्रोथ स्टैंडर्ड्स भी कहा जाता है, जिसमें हमारी लंबाई, ऊंचाई हो या वजन हो, उसे उम्र के अनुसार बढ़ना चाहिए. बट कई बच्चों में, many children do not grow as per the speed that is expected, and that's where we call it as growth faltering. So they are not growing the way they should grow. So they are growing slower than what is expected for their age and sex, and hence we call it as growth faltering. Now, when does this happen? A typical understanding is children falter after 6 months of life, and there is a lot of malnutrition seen after 6 months of life. But that is not the case, and we see faltering even at birth. जन्म के समय, पैदा होते समय भी कुछ बच्चों के जो वेट लेंथ जो होनी चाहिए वो होती नहीं है, एंड देन they continue to falter in the first 6 months of life also, and we call that as early growth faltering. Now, just जानकारी के लिए कि what is the ideal weight that a child should be born with? Lot of us say 2500 gram or 2.5 kg, but that's not the ideal. The 3 kg or even 3.2 kg is an ideal weight, but 2.5 kg is like passing mark. The way we have passing marks for any exam, it is a passing mark for birth weight. So it's like lowest cutoff for having a normal birth weight. And what is the kind of length that we are born with? Again, a lot of people might not know about it. 50 to 52 centimeters is the normal length that every child should be born with. And then there is a potential to grow in the first year very rapidly, and in the second year the growth speed slows down, and in subsequent year it slows down substantially. And then finally, when you enter adolescence, there is another growth spurt that comes wherein height starts growing again. But so for us, and for the sake of this presentation, we say that early growth faltering is something that happens at birth and in the first 6 months of life. And how do we really address it? Now, what causes early growth faltering? And there are factors related to parents, and here I mean both parents, but more importantly, mother's height, mother's weight, and mother's BMI during pregnancy has an important bearing on what kind of birth outcome a child will have. Then there are again at birth characteristics that determine the growth faltering in the first 6 months, whether birth length, birth weight, or even when the child is born in terms of gestational age. Some children or some infants are born quite early than expected in terms of so 37 weeks is the normal gestational age. If we cross 37 weeks, then the child has completed the term of pregnancy. But there are many births that happen even before time, and those again determine the growth pattern of that child going forward. Postnatally, what is the breastfeeding? How is the breastfeeding being done? Is it effective? All those things matter to really get into a good growth trajectory. And of course, there are other several factors at household level which also determine. And then why are we worried about it? I mean, let the children falter. What happens? And then there are some consequences, and some of them are very serious consequences. What happens? Child may die. If child is faltering the weight, child may die, which is called as childhood mortality. Child may fall sick. Child may have different diseases, not only in childhood, but child is also becomes prone to some diseases later in life if the child is born with lower weight or falters early in growth. And of course, then there are issues with cognitive development and subsequently economic outcomes. So all this happens because of early growth faltering. Now, what is happening in India? So in India, if you see NFHS data, we see that 18% children are born with low birth weight, with the definition of 2.5 kilogram and lower. Now, if we kind of classify them into wasting and stunting, 37% of them fall in category of wasting at birth, and then 32% remain wasted even at 6 months, and then it starts dropping. You can see the graph on the left upper graph. Similarly, for stunting, 16% are born stunted, and stunting steadily rises in the first 6 months of life and up to 2 years of age. So the point is, growth faltering is happening early in Indian children, and hence focusing on that is critical. Now, we also tried to analyze some of the cohort data on how children grow and where do we see faltering happening and what are those risk factors that determine faltering. And some of those messages are here. Number one, we see anyways, we see in general high prevalence of wasting and severe wasting, which is a form of malnutrition through our surveys. We see it highest in the first 6 months. And among the children who are born either at term but with low birth weight, we see it more. We see it more in the months of monsoon and summer. And then there are other risk factors that are associated, which I also spoke about in the previous slide. Now, why is it important to address it early? And this is the most important slide, I think. Can we predict future wasting? क्या हम उन बच्चों को आज समझ सकते हैं जो आगे चलकर कुपोषित, मैलनरिश्ड या वेस्टेड बन सकते हैं? और हमने देखा कि ऐसे बच्चे जो पहले 6 महीने में एक या एक से ज्यादा बार वेस्टिंग का शिकार बनते हैं, उनमें आगे चलकर 12वें और 24वें महीने में, मतलब 1 साल और 2 साल की उम्र में कुपोषित या वेस्टेड बनने की संभावना बहुत ज्यादा होती है, रिस्क बहुत ज्यादा होती है. 3.1 times at 12 months and 3.5 times at 24 months. And we also saw that almost 2/3 of children who are wasted at 12 months or 24 months have had one or more episodes of wasting in the first 6 months of life. So अगर हम पहले 6 महीने में जो ग्रोथ फॉल्टरिंग हो रही है उसे एड्रेस कर पाए तो शायद हम फ्यूचर में होने वाली वेस्टिंग या मैलन्यूट्रिशन या कुपोषण को भी रोक पाएंगे. एंड हेंस द फोकस should be more on the first 6 months and addressing growth faltering in the first 6 months. अब हम ग्रोथ फॉल्टरिंग को जो समझते हैं, we understand it from the perspective of measurement of weight or height or such parameters. But there could be some other risk factors beyond anthropometry or beyond these measurements, which could also make child vulnerable for for growth faltering. And hence we have kind of gone beyond anthropometric measures to understand the risk, and we can classify children accordingly into different categories of risk and try and address them from the beginning. It's also important that it's not only risk related to child or infant, but also risk related to mother, which has a bearing on child's growth. So there are certain factors or certain risk criteria among mothers also, which are important to be identified and addressed. Now, there are 3 risk factors here. So number 1 risk factor is birth weight. Those who have less than 1800 grams of birth weight are at a severe risk of growth faltering anytime early. They are actually faltered growth at birth, and they are likely to continue into that trajectory of faltered growth. Those who have 1800 to 2500 grams, they fall under moderate risk and need support to really catch up their growth. And those who have good birth weight above 2500, they have lesser risk or no risk. Number 2, any infant or child who has any health issue in terms of either infection or any danger sign or symptom, they are at severe risk of faltering early, and hence identifying those medical issues or health issues and addressing them timely is critical if we want to stop this growth faltering early. Number three, how are children growing? Between previous weight reading and today's weight reading, or any time the child is being measured, there should not be a loss of weight except for the first 2 weeks where you see some loss of weight in 14 days. But after that, there has to be weight gain between subsequent visits and readings. If there is a weight loss between subsequent visits, then there is some problem and those children are at risk of growth faltering. If there is any loss of weight which is not really understood, or we are not able to define the reason, then it's a severe risk. If there are any congenital anomalies with regards to feeding like cleft lip, cleft palate, etc., those children are also at higher risk or severe risk, and hence they need support, additional intervention. On top of it, in the middle column, you see breastfeeding and related issues. Again, we think that breastfeeding is a very easy intervention and we just give messages and mothers will be able to breastfeed. That's not the case. There has to be an effective breastfeeding. Nowadays, I have started saying we should not be talking about exclusive, but we should talk about exclusive and effective breastfeeding, wherein there is good attachment, good positioning, frequency is better, and in fact sucking is better, and children are being fed from one breast fully, so that foremilk, hind milk, everything is provided, and there is good growth in the first 6 months of life. So these are some of the infant related risks which needs to be identified and addressed. There are also risks related to mothers, and those have bearing on child's growth, because mothers are unable to take care of their children if they are also running some risk or some medical illness, and those also need to be identified and addressed. I'll not go into the details of it, but they are basically related to mother's health and nutrition status, including their BMI, anemia status, as well as mother's psychosocial status, which also is an important aspect. Now, how and where can we really identify and address these risks? There are certain things mentioned here, but there are certain platforms available at the community level, which are mentioned in the middle column. And then there are health facility contact points wherein, all these infants uh, give us an opportunity to see if they are running any risk, identify those risks and address them properly. How to address them, what to do is something that Dr. Ashutosh will speak. But just to leave with you with this thought, that there has to be some convergence and coordination at the lowest level with all the workers that are available, because there are mandated scheduled visits for them and contact points for the children, and all those could be utilized to identify these risks and address them to prevent growth faltering early and in later life. Thank you.